Florence Nightingale, known as the founder of modern nursing, revolutionized healthcare practices during the 19th century. She established the first professional nursing school in 1860, providing formal education and establishing standards for nursing practice. Her work in sanitation led to a significant reduction in mortality rates and showcased the importance of hygiene in medical care. Florence Nightingale's dedication not only transformed nursing but also inspired future generations to prioritize compassionate care and professionalism in healthcare. Her influential book, Notes on Nursing, served as a foundational text for nursing education and emphasized the significance of patient observation. In 1907, she became the first woman to receive the Order of Merit, acknowledging her unparalleled contributions to healthcare and nursing. Florence Nightingale's legacy continues to influence modern nursing, emphasizing the importance of education, research, and evidence-based care.